Want to get medical care right in the comfort of your own home? Most people do. Medicare can pay for home health care if you meet the qualifications. This kind of care can help you get better and be more independent. It's often cheaper and easier than staying in a hospital or going into a skilled nursing facility. There are a few important rules to know though. First, how are you able to get Medicare to pay for home health care? Well, to get Medicare to pay, you need to meet some simple rules. Okay, first, a doctor must be in charge of your care. This doctor or another approved healthcare helper will make a plan for you and check on it often. Second, your doctor must say you need special medical care, like skilled nursing care that's not 24 hours a day. This can be from a nurse who is giving shots or changing bandages. Another area is physical therapy. Maybe speech therapy for talking or swallowing, or occupational therapy to help with daily tasks. Third, your doctor must say you're homebound. This means it's hard for you to leave home without help, or it takes a lot of effort because you're sick or hurt. You can still leave for doctor visits or short, rare trips. Fourth, your doctor must have had a face-to-face visit with you about why you need home health care. And lastly, you must get your care from an agency that is approved by Medicare. It's called a Medicare certified agency. What Medicare will pay for in your home is a big question. If you qualify, Medicare pays for many services that are needed to treat your illnesses or injury. This includes skilled nursing care. This is care from a nurse like we talked about, giving shots or changing bandages. It must be part-time, usually less than 7 days a week, or less than 8 hours a day for up to 21 days. Therapies. This includes physical therapy, occupational therapy, and speech therapy. These help you get better or keep your current health. Home health care aid services. If you need help with things like bathing, dressing, or walking, an aid can help. But Medicare only pays for this if you are also getting skilled nursing or therapy. Medical social services. If your feelings or home life are affecting your treatment, a social worker can help. This is only covered though if you're also getting skilled level of care. Medical supplies. Simple supplies like bandages are covered if your doctor orders them. Durable medical equipment. This is things like wheelchairs, walkers, or hospital beds, and they're covered by Medicare usually around 80% of the cost after you pay your yearly Part B deductible. What Medicare will not pay for. It's important to know what Medicare does not cover for home health care. Number one, 24-hour care in your home. Meals brought into your home. Helping with shopping, cleaning, or laundry unless it's part of your medical care. Personal care, like only bathing, dressing, or using the bathroom. If that's the only help you need, Medicare is not for long-term care. This is where additional insurance comes into play and can pay for these costs. If you end up qualifying for home health care, the next question is, how much will you pay? For most covered home care services, if you have original Medicare, you pay nothing. For medical equipment, like a walker, you usually pay 20% of the cost after you pay your yearly Part B deductible. Before you start care, the agency should tell you in writing and by talking how much Medicare will pay and what you might owe. An advanced beneficiary notice, an ABN, if the agency thinks Medicare might not pay for service, they must give you this form. It tells you why Medicare might not pay and what it could cost you. If you sign this form and get the service, you're going to likely be paying for it. Notices about changes. If your care is changing or stopping, the agency must give you notices like the Home Health Care Change of Care Notice or the Notice of Medicare Non-Coverage. These notices tell you if your services are ending and how to appeal if you think they're ending too soon. Now, picking the right home health care agency. You get to choose which Medicare-approved agency helps you. Your doctor or hospital should respect your choice. Here's what to ask when choosing an agency. Is it approved by Medicare? This is super important for getting coverage. Do they offer specific help you need, like nursing or physical therapy? Can they help with any special needs you might have, like language? Do they have staff ready for emergencies at night or on the weekends? Have they clearly told you what Medicare will pay for and what you might owe? Medicare only pays for care from one home health care agency at a time. Medicare Advantage plans versus original Medicare. Big question. Medicare Advantage plans are offered by private insurance companies, not the government. While they are supposed to cover the same home health care services as original Medicare, these private plans typically have a network of home health care agencies that they work with. This particular restriction could limit your access to certain home health care agencies. Some Medicare Advantage plans do offer extra home health care help that original Medicare doesn't cover, but these extras might have limits too. If you have a Medicare Advantage plan, always check with them directly to see what they cover for home health care. This can be confusing, so it's best to ask them first. Now that we have covered when Medicare will and will not pay for home health care services, let's quickly touch on how you can protect yourself further before you actually need home health care or even long-term care services. One of the most popular ways retirees cover themselves is with a standalone home health care insurance plan. These plans are lower costing than long-term care insurance and focus on benefits that allow you to be cared for in the comfort of your own home. Another popular way is to enroll in a short-term recovery plan that provides benefits for not only home health care, but if you need, nursing home care. These plans typically will provide benefits for up to 1 year. Of course, for full coverage, you can look into long-term care insurance, which will provide benefits for home health care, assisted living, and nursing home care. These plans cost more, but also provide comprehensive protection. One thing to keep in mind is that everyone's needs and budget are different, so it's always best to talk to an advisor. Medicare can be tricky, but you don't have to figure it out alone. As Senior Benefit Services, we help people just like you understand Medicare clearly. We've helped many seniors in Maryland, Pennsylvania, Virginia, and West Virginia get the right plans so that they are fully covered. Are you ready for help with your Medicare? Call us today for a free Medicare chat at 1-800-924-4727 or go to our website at www.seniorbenefitclient.com. Please like, follow, and share this video with friends and family. We want to help you stay healthy and safe with your retirement.